Daytime. I'm Cindy Edwards.
And I'm Jerry Penacoli. Nice to have you with us. And we've got a real special kickoff to the show today that we're going to carry throughout the show. And you're going to find this very interesting.
Yes, you are. We are starting our show off today with our panel of medical experts discussing the latest in health and wellness. We are joined by Dr. Srinivas Lyengar, a cardiologist, and Dr. Adam Scheiner, a plastic surgeon, and Dr. Gamal Wazni from United Vein Centers. Gentlemen, good to have you all here.
Absolutely. All familiar faces to daytime, so it's nice to have you. Now, our first topic is something that's very controversial right now. It's about a three-parent baby. The controversial method uses genetic material from a donor in addition to that of the couple trying to conceive. Now, the purpose is to overcome flaws in a parent's mitochondria, and we'll have the doctors explain that. Now, that can cause grave illnesses in babies. The procedure is said to be successful, but it opens the door to what medical professionals call designer babies. What do we think of this?
Well, I will tell you, so Jerry, just starting it off here, this is fascinating, amazing type of progression in medical technology. This is basically an ability to take the mitochondria, which are like the power, the energy cells of the body, which have nothing to do with the DNA, and remove them and implant the DNA in someone who has normal mitochondria, because there's diseases where the mitochondria become basically deficient or work in weird ways, causing these really severe childhood diseases.
So is this prevention, or is this, do we already know the parents might have a problem genetically?
It's exactly the pre-test issue. They're going into the pregnancy knowing there's a really strong chance that they will have it. So you're trying to say the baby, you want to prevent the baby from having any problem with this mitochondrial disease. So it is amazing that this can be performed and done safely.
I see absolutely nothing wrong with this personally. I know some people have problems with it ethically.
Oh, I think a lot of people have problems ethically.
One of the issues is the labels that we give, this idea of a three-person baby, and that's not really correct. I mean, you know, you were right in saying that these are parts of the DNA in the system that go awry, and if we can have a healthy baby, then I think these issues become sort of moot. I mean, if we can raise a healthy baby that had otherwise, you know, a lifetime of problems, this is a great thing that we can do.
I have a different view. I think this procedure was developed about 20 years ago, and since then we've learned so much about the DNA, so much that we think now we almost knew nothing 20 years ago. So what are we going to think 20 years from now when we discover that what we've been doing is actually reinventing things? Right now we're taking a very simplistic approach and looking at it as we're just moving mitochondrial DNA, which has nothing to do with your physical characteristics or inherited qualities. But 20 years from now, when we find out we have done that, then what are we going to do?
If I knew that I carried a gene, though, that there was a chance that I would have a baby, that I would have to suction their lungs every hour, and that I knew that their life expectancy was 5 years, I would do everything in my power to not give that gene to my baby.
So what do you say to that parent, Dr.
I think
Wazni?
that parent needs to be educated. I think the approach that they're taking now is it's no big deal. This is completely different. It's not really DNA transfer. I disagree with that. I think that the parent needs to know that this could very well be some transfer, and they have to understand that, and it's a bit like adopting. It's taking care of a child that, you know, may not be 100% yours.
So you think this is opening a Pandora's box?
Could be.
But I think that actually we should allow research. You know, this is actually already going on in England. They're doing the research with this in England, and that's how science moves forward. You try this, you do it slowly, and then you see what issues come up. And then I think we should allow it in the U.S. so we can understand if this is a really viable treatment for the future.
And taking it back to the human approach again, Cindy, I'm a parent, and if I know this is going to happen, you know, in all due respect to people's opinion about 20 years or having this change, I'm going to tell you something. I'm going to do everything I can to save my child.
Yeah, me too. All right, it looks like maternal mortality rates are declining worldwide, but unfortunately the situation for women here in the United States is an exception, especially in Texas, where the rate of pregnancy-related deaths more than doubled over the course of 2 years. What in the world could be the cause of this?
Yeah, this is sort of a big question that we're having, because they looked in the entire U.S. we're having problems with maternal mortality. Turns out in California it's actually going down a bit, where in Texas it was going up. There's ideas that possibly it's due to defunding Planned Parenthood. That's, I think, a little simplistic to really look at. We don't know exactly. I have to say this is a bigger issue, because in the United States we don't have the best outcomes for health care compared to other countries. We spend more than any other country does. We don't really
Why is that?
Yeah, but we don't have the best outcomes. I think that we pay more for, we will compensate doctors for disease, but not really for health.
Right.
And I think that's one of the issues that we have here.
And the thing is, again, when we look at this, a lot of other countries in the world, Europe being a perfect example, Switzerland, Sweden, those countries have a great prevention and proactive post-procedure that when a mother delivers a baby, very supportive. They have time off. They have a lot of support system. We don't really have that here.
We have to demand that as a nation.
And that's the problem is that we see a lot of
huge
issues
political
that
issue.
we see. You're out of the hospital in 24 hours, get out with your baby, and good luck. You know, it's a big problem.
It is a huge political issue, and it has something to do with the Planned Parenthood, where a lot of those females that were pregnant were actually going to Planned Parenthood because it was easy access.
Sure.
We have taken away that access in states like Texas.
And now mothers are dying because of it.
They don't have the access to health
It's
care.
right there. How can people even deny it?
Yeah,
Absolutely. All right, we're going to take a break here. Stay with us because later on in the show, we're going to have more with our panel of doctors, including a topic about something called, and this is a strange one, but just bear with us. We're going to get to it. Beauty parlor syndrome. Interesting.
We'll be right back.
And we are back with our special panel of doctors, cardiologist Dr. Srinivas Lyengar, plastic surgeon Dr. Adam Scheiner, and Dr. Gamal Wazni from United Vein Centers. Round two, guys.
Here we go. All right, earlier in the show, we told you about something called beauty parlor syndrome. It's a rare but very real phenomenon called iatrogenic vertebral artery injury. Am I close?
Leave the pronunciation to the doctor.
Iatrogenic vertebral artery.
Okay. It happens when you rupture an artery in your neck that goes to the base of the brain, and it typically happens when you sit at the washing bowl. A similar neck risk exists for some yoga poses as well. Should we be worried about this? I've heard about this.
I don't think you should be worried. You might as well add in there, if you're laying on your stomach and you decide to look up, this can happen also.
Right.
It's really just a positional thing. Those who have atherosclerosis, which is plaque buildup in their arteries that's hardened later on, is going to narrow those arteries, it's going to narrow those pipes. So when you look up or hyperextend your neck, there's even more narrowing. That can decrease the blood flow to the brain and cause a stroke. That can happen if you hyperextend your neck into a bowl at the parlor, or if you're looking up, as I said, or a yoga pose. So again, it's just a positional thing more than anything.
Are older women at higher risk because of their arteries, perhaps?
Well, I would also comment that not only because older individuals tend to have more atherosclerosis, it's also that think about it, your cervical, your neck, your bones in your neck, you know, that obviously the older you get, there's more arthritic changes. So you would like to believe that you'd like to do less aggressive things or movements to your neck area as the older you get.
So how do we prevent this?
Well, I don't think there's necessarily a way to prevent it as much as to say, listen, use common sense. You know, if you're going to do something that you haven't done before, like a hyperextension yoga pose, or be in a beauty parlor for the first time, maybe you want to think of actually moving your neck around and seeing how much you can actually do without pain developing.
Right, they've actually talked about watching the angle that your head is in the washing bowl, you know, and that might prevent that sort of hyperextension. This has actually been shown in other fields, such as chiropractic. There's been cases there. The same thing with manipulations, and that's the idea of these vertebral vessels, is that if you're too rough in that area, you could hurt that region. So there are cases where people have had strokes with chiropractic with excessive manipulation.
All right, we're going to move on to this topic. Pediatricians are encountering more parents who refuse to have their children vaccinated. This has been an ongoing issue, it seems, for a very, very long time. Now, this is because of some medical worries that they don't want to have their kids vaccinated. Others feel that they don't want to because they just don't see the point of vaccines. The most common reason provided by 3 out of the 4 surveyed thought vaccines were unnecessary because the diseases they prevent have been wiped out in the United States. Should parents vaccinate or not? Absolutely. Can we come up with a definitive answer here?
Yes,
absolutely.
Absolutely. Everyone needs to understand this is ridiculous. You know, children absolutely need to be vaccinated. And from my personal perspective, I will tell you right now, as having children, you know, no doubt, herd immunity, which basically means people protect amongst the community by getting vaccinated. It's very important that their immunosuppressed individuals don't get these types of diseases because other children are vaccinated. It's very key that we really emphasize that the vaccines have not been linked to autism.
Right.
The vaccines are safe overall, and we've known that the reason why the diseases are eradicated were because of the vaccines.
Aren't we seeing a resurgence now in
there's
some rare...
been cases actually in Disney, right? In 2015 we had a measles outbreak, and I think it's a big issue because there's problems with pseudoscience that we have on the internet, and people read these things, but it's the biggest advance we've had in medicine is vaccines.
So what are the risks if parents don't vaccinate their kids?
People are forgetting that the diseases that we've gotten rid of are still there. They're a plane ride away. They're in other countries. So if you don't vaccinate against these diseases and a visitor comes to this country, which they do and they're free to do so, you can be exposed to disease that you should have been vaccinated against.
Yeah,
it's
really
a huge
important.
risk.
All right, a recent article in the opinion pages of the New York Times discussed the reviving of house calls. Before 1950, nearly half of all doctor visits in America were house calls. The author of the article claims that for frail, elderly people, house calls saved Medicare $4,200 per person per year. So what do you think of making house calls?
Do you guys want to make house calls?
Can I be very fair? I think the three of us are specialists in our fields, and performing a number of the procedures that we do, impossible to be done in an outpatient setting, or I'm sorry, take that back, in someone's apartment or house.
We're talking about
if you
general
were
practitioners.
GP.
Yes.
Yeah.
Pediatricians, general practitioners, family practice, internal medicine, and geriatricians, I mean, phenomenal idea. I can't tell you how many people who can't leave their homes, especially in the winter, especially at times where they can't travel, they have to get an ambulance to take them to the office, they miss their appointments. And you know what their next appointment is? The ER. So it's better to prevent them from coming to the hospital in the first place.
But isn't there a form of house calls happening these days, but unfortunately only for people who have the money to pay for something called concierge doctors? We've heard so much about these doctors. How do you guys feel about that? And should they be made available, across the board?
It is about funding. I mean, interestingly, what Medicare did here was a pilot program. They were trying this out. They were compensating doctors a little bit more for these house calls. And they're being innovative here. If this can work, they can roll this out. So this would be great. But if you're making more in your office than you are going out, this won't succeed.
But the doctor that they cited in the article was actually making house calls.
Correct, but it's about safety.
Right.
And if we can ensure that these older and frail patients are not going to fall on the way to the doctor's office, or are actually going to see the doctor, because otherwise it may be a big inconvenience to get someone to drive them to the doctor. Again, this is a safety issue.
And the old statement is that patients used to pay in apple pie or pay in whatever they could do, and it used to be, it warms the heart, but unfortunately it doesn't pay the bills. And that's why it's such an unfortunate situation that we're in right now, that to make the justification for house calls to be viable, well, the doctors have to realize that I'll give up my practice to do this, not just for the good of the patient, but also for the good of themselves and their practice.
All right. Doctors, thank you very much.